This is one of the worst decisions I've ever seen by a government with health services. They're trying to pull the wool over Tasmania's eyes.
Our mental health services are under attack with threats of privatisation, which could have long-lasting and damaging effects on the wider community. This has led to mental health workers walking off the job, supported in huge numbers by the community. To talk more about that, Robbie Moore, the HACSU State Secretary, joins us for this HACSU vodcast, your Health and Community Services Union. Robbie, obviously seeing workers walk out at Tolosa Street Adult Mental Health Services. Tell us what that was over.
So workers stopped work to rally, and they were forced to do that because the government is intending to privatise their work and hand it over to Richmond Futures. In doing so, they're reducing the amount of beds as well, which is obviously of great concern, but it'll also mean that they can't deliver the same services. And even though these workers are probably going to lose their job, what they're more worried about is the patients and the people that they treat every day and what's going to happen to them, because Richmond Futures does not have the capacity that they have to deliver services, and this is going to impact on the entire health system.
The community support at this walkout was huge.
Amazing. The staff were overwhelmed. I was just talking to a worker who said she came to tears seeing that much support for the work that they do, because they probably think it's not seen in a lot of cases, but the community know. They've had family members perhaps that have been there, or they know of friends who've been supported through there and been able to then get back into the community as a whole. So the support was, totally overwhelming. Political
support too, were you surprised by how many politicians showed up?
I don't know if I was surprised, but I was certainly really glad to see them all. We had 2 representatives from the Labor Party, 2 from the Greens. We had David O'Byrne and Christy Johnson, 2 independents there. It was fantastic. The support from the Shadow Health Minister, Ella Haddad, was fantastic, and having Josh there was great as well, obviously. So, and of course, both Cassie O'Connor and Helen Burnett from the Greens. So, look, we found that really important, because they're the ones who can hold the government to account. When Parliament resumes, they've all committed to doing that and to stop them from doing this to the mental health service.
Tolosa Street Adult Mental Health, the facility there. What have they been doing primarily within the community? What is their main role? There's 12 beds there?
Yeah, this is a 12-bed facility. 6 of the beds have some longer-term people with a mental health condition that they're trying to obviously improve their situation, and 6 of the beds are used more like respite, but that includes bringing people out of the Royal Hobart Hospital, freeing up beds there that are able to take up beds at the Tolosa Street facility. So it's a really vital part. It connects our health system. It stops some of the bed block issues, some of the waiting times in the emergency department, because we can free those beds up on the mental health ward, which means we can reduce things like ramping. So this is a really vital service. If it is privatised, those opportunities won't be able to happen. The private sector works very differently, and we're certainly really concerned about the impact this is going to have on mental health services and our health system.
Why would the government want to privatise a service like that is doing so much?
Look, it makes no sense why the government is doing this, but we can only assume it's to save money. They've done some really dodgy things with this. So the building that they're proposing that Richmond Futures would be handed over to do with was actually built by Homes Tasmania. They should be providing homes, not health facilities. So they've dabbled with the books in that way. And then again, the private sector have lower wages and conditions, so they're able to pay less. And because they're reducing the amount of beds, there'll be far less staff. So all in all, this is a cost-saving measure because the government have mismanaged our budget in so many other ways, like the TT line fiasco, for instance. It appears that they're trying to cut health services to save money.
Can you just explain part of that again to me, just to make sure I've got it right? So they've taken money from Homes Tasmania and they've diverted it into a building which they then are going to sell off to the company that's going to privatise this facility in Tolosa Street.
That's right. They've given Richmond Futures the ability to lease that building, and it will be therefore a health facility, not long-term accommodation, which is what Homes Tasmania should be focused on. So the Tasmanian taxpayer is getting hit in different ways, and it means we're providing less homes for Tasmanians as well by using Homes Tasmania money to build health infrastructure.
That's just, how do they get away with, how?
Well, I think this rally proves they're not going to get away with it. That's why we got such an amazing turnout, because people are very angry. They're angry if you care about homes and accommodation for Tasmanians, but they're angry because they're reducing our health service at the same time. So this is a very dodgy government decision where they're trying to pull the wool over Tasmania's eyes. And the reality is, I think the turnout that we saw proves that people aren't going to stand for this.
We've seen privatisation happen in the past. With St Helens is one that just comes to mind, which was a complete failure. What does privatisation actually mean? If you could break it down for someone like me, so I can have a handle on it. It's public, it goes private. The government's saying there's not going to be any job losses. What's the reality of something? What's the difference between the public and private?
Privatisation of essential services, especially health services, never works, never have. We only have to see all the issues in the aged care industry since it's been privatised. Disability services, there's lots of scandals going on there. They're associated because once you get privatisation, you get for-profit organisations, or some organisations that mightn't be technically for-profit, but they are focused on profits, and they prioritise that over people. It means that you're paying taxpayer money to make rich people richer and to give them more money. So we've seen a situation where Richmond Futures, the employer of choice in this case for the government, have announced they're withdrawing services in the north of Tasmania. So we know when the private sector operate things, they'll withdraw it if they're not making money, whereas we know if the public sector is running it, they have to provide the services to Tasmanians. So that's why we need to keep these things in public hands so that the government is the one that's accountable for when things go wrong.
Once it goes private, they then can have a say over who goes in. Is that correct?
That's correct. Any private operator can choose whether or not to give you a service. That's their right. Where in the public sector, they're obliged to treat us all equally and treat all of us if we're in a situation where we're needed. So this is why the private sector being in essential services is a really terrible idea and doesn't work. It fails Tasmanians. And we know that Richmond Futures and any other organisation would regularly say for different reasons, we're not going to be able to take that person, sorry, you'll have to do something else. If it's in the public health system, it's all run by the Secretary of Health, who end of the day makes the ultimate call and will say, sorry, Tolosa Street, you've got to take this person on, and they're obliged to do it because that's the Secretary's call. So that's why it is essential that we don't allow this privatisation to happen, because it'll mean that Tasmanians will miss out on services.
Yeah, I'm guessing it'll go to the people that can then afford it.
Yeah, and we've seen that the private sector is always driven by money. So we'll add a charge onto that. We'll make a bit more money here. They'll only take the patients that they can get the most money from. It might be from your private health insurance, etc. So this is why it's essential that we have good public services that give all Tasmanians access to it, just not those with big credit cards.
I find it pretty scary, to be honest. I know a lot of people that have used services in our mental health system, and it's saved their lives, and it seems like the more we know about it, the less is invested in it.
This is one of the worst decisions I've ever seen by a government with health services, to literally close a service that is working really well, that has helped so many Tasmanians out, and it's just about their budget. They don't care about people, and so that's why we have to hold this government and ultimately the Premier Jeremy Rockliff accountable.
How can people get involved? Anyone watching this, listening to this?
Contact local state politicians and tell them that this is just not good enough. The more phone calls they get, the more emails the politicians get, the bigger they take this issue, because we have to get this government to back down. We've launched a petition now, and we're not going to back down on this. We're going to save that service. We're going to have further rallies. We're going to have further activities. Please stay tuned to our Facebook so that you know what's going on, and join in our campaign today, because we really need you.